Loss comes in many forms, and usually in unexpected ways. It can be devastating, leaving you facing an uphill struggle to go on with life without someone you thought would always be there. But life does go on, and even in the deepest despair, we can find hope. Welcome to Grief Relief with your hosts, Drs. Gloria and Heidi Horsley, brought to you by the Open to Hope Foundation, helping people find hope after loss. And now here's Dr. Gloria and Dr. Heidi.
Hello, I'm Dr. Gloria Horsley with my daughter and co-host,
Dr. Heidi Horsley.
Welcome to the Grief Relief Show. Heidi, we have got some great guests on today and a tough topic to talk about, and that's suicide and also drug and alcohol abuse when family members die of drug and alcohol abuse or suicide. There's a lot of commonality between these two, and we'll be talking today with our guests about how the world responds to these kind of losses. It's tough.
It is tough, Mom, and I'm really glad we're having the show because, as you know, drug and alcohol use and abuse is on the rise, and it's happening so often, prescription medication, etc., and we see these kind of deaths often, and like you said, they're stigmatized a lot. And suicide losses are stigmatized, and oftentimes families don't get the support that they need around these kind of losses.
And dying of drug and alcohol abuse has some stigma connected to it, too. Well, we're going to have two wonderful guests that we're going to talk to today, three, but we're going to start out with a husband and wife team.
I love that.
Yeah, William and Beverly Feigelman, and we'll start with them on the show. They've written a great book. They're authors of Devastating Losses, and it's impressive, all the research that they've done, isn't it, Heidi?
I was just talking before the show to Bill and Beverly about this, yes, because not only have they woven in some story, narrative, but they've really got all the current research from all the leaders in the field.
And they're both professionals. Beverly's an social worker, and we can talk about that, and her husband, William, is a professor emeritus at college, and we'll discuss that with them. But they also had a tragedy. They had their son, Jesse, die by suicide. And we'll be talking about how they got involved with the research and giving back. I mean, talk about giving back people. One of the things that we like to talk about on these shows is how you can go forward, how you can give back, and how you can heal those losses with service. Absolutely,
and part of their service is building awareness for this topic. And one thing that I like about them, which is also true of us, is that they have one foot in the professional world and one foot in the personal world that they've lived it. And I think when you've lived it, it really changes you in so many ways professionally. At least it did for me.
Right. And we're going to have Vanessa McGannon is going to be on too, and we're going to talk a little bit about the American Association of Suicidology, because there are some, and we're going to show a clip from the American Association, because there are things for you out there if you've had these kind of losses to give you support and community. And then we're going to end the show with Larry Stevens, and he is going to sing One for Love. So let's get started and say hello to Bill and Beverly. Great to have you on the show today.
Thank you.
Hello,
We're
welcome.
happy to be here. We're honored to be here. It's a privilege.
And let me say, we are so sorry about your son to start with.
Thank you.
A huge tragedy.
Yes.
Yeah. And I read about him in your book. He's son of a filmmaker and a lovely human being in his, what, 30s? 31.
He was 31 when he died. And it was 11 years ago that he took his life by hanging. And we miss him every day. And yet we want to honor him and do things that he would be proud of. And that's what we do. Try to, leave some positive memory of him that will take his life and put it into a positive framework and helping others.
Yeah, I like that. And you're also helping other families to navigate these waters and to find hope and healing as well.
Now, you were both professionals when he took his life. Beverly, were you?
I'm a clinical social worker, and I had worked in the field of substance abuse for many years and had a private practice, and I teach.
And where are you located?
We are in Queens, in New York area, and I have a private practice in Queens. And when Jess completed suicide 11 years ago, he was living in Brooklyn, and living with his fiancée. He had recently become engaged, so we were just overwhelmed and shocked that this had happened. You know, death by suicide just grabs you, and you're not prepared in any way, even though there might have been a history of prior attempts, or there might be a history of depression or other kinds of factors. When you get that phone call, or you walk into the room and you see your loved one hanging, or a gunshot, it's just, you know, you don't know if you can breathe again or face the next day again. And as a professional, so I had two major losses. It was the loss of my son and my role as a parent. Parents like to think, and mothers, that we will, you know, protect our child. That's our mission in life, to have this baby grow up and be healthy and, you know, outlive us. And also as a professional, here I am, a clinician. And
even in the drug and alcohol area, because he had some problems with that.
That he had use of drugs, and that he had, you know, different kinds of things going on in his life. He was very highly functional in so many ways, and we just never put the pieces together that would be a road that he would choose, that he would get to a point where he would be so desperate. And Bill talks about it being the perfect storm for him, for Jess. There were a lot of factors, and he'll share some of those. But for me, as a clinician, it was just, you know, how could I have missed this? And
right, and I think there's so many people saying, how could they have missed it? Couldn't I know? We know that sometimes when people take their own lives, it looks like they've been feeling better and all that kind of thing.
Sure.
And we'll talk a little bit about your book, Bill, and show it to them, because this book, I will tell you, if you've had a loss, a suicide, you need to get this book. There's no question about it, or in drug and alcohol abuse. Can you hold it up a little bit like that? So I'll hold it for you.
The book is based on a study, a survey we conducted starting in 2006 with 462 suicide bereaved parents, and then a couple of hundred others to add up to 575 bereaved parents, some who died by drugs, some who died by accidents, some who died by natural causes, and we compared and contrasted the groups.
You know, I've been looking at this book, and I would like to, one thing that I would like to hit on is the stigma. You talk about like 3 areas where people are stigmatized. Can you talk about that? Because I think that's really important.
The centerpiece of the book, the stigma. People afterwards avoid the bereaved parent, the whole family, in fact, and they just don't know what to say, don't know how to deal with them, and the best strategy, they think, is to give them space and let them breathe, but they don't show any compassion. And people want and expect, especially after their worst ever loss, that people are going to embrace them, people are going to hug them, people are going to say, I'm sorry, but instead people say nothing.
And let me say one thing I noticed in the book, that for people, it's not just suicide. You also say in drug and alcohol deaths, that people do that same kind of stigma, right?
But we found half of the bereaved by drugs, half of the bereaved by suicide heard after the death of their loved one blaming comments, blaming the child. You know, he was no good, she was no good, you should have done better in getting them therapy. And the worst possible thing to say to a bereaved parent is that you don't need to think about them anymore. They're gone, and you know, you should be glad they're gone. I mean,
they were just a problem anyway.
They were
just a problem.
We heard someone report when her dog died, the vet sent a card from the office, was so sorry for the loss of your pet. When her son took his life by suicide in the same small town where people knew about this child, the pediatrician that had treated him, who had known him all his life, just avoided the family and never acknowledged the loss. Wow. So even professionals who have trouble and struggle with this sense of It's a shame, it's a stigma, and we don't know how to deal with this, and they're uncomfortable and they avoid.
You know, my husband and I do a Compassionate Friends group, and we sometimes, you know, fairly often have people either die from, kids who have died from drug and alcohol or suicide. And one of the things that I've noticed is that dads, when they come in, they seem to be a little more angry and have a little more trouble with therapy. Am I wrong? You know, they feel, you know, just really...
Well, we don't find that many men involved in the grief experience in joining groups and seeing therapists. They hold it in more. There's more externalization. They might do some kind of a memorialization thing in trying to memorialize the lost child or a person, but they won't be as tearful and as emotional about it as women are usually.
So is that okay? I mean, I have women who get in touch with me and say, my husband just recently, 6 weeks ago, someone I know's son took his own life, and actually it was a drug overdose, and she said to me, my husband isn't dealing with it, and I'm like, you know, is that true? I mean, can I deal with it the way I want to deal with it? Can men deal with it the way they do? Or?
No, men dealing with it in different ways, and people have to respect each other's way of grieving, and it's not a matter of there's one right way to do it. You know.
After Jesse died, I needed therapy, I needed groups, I needed support, and we went together, and then Bill said, it isn't helping me, I don't need this. And I continued on my own. But for Bill, he found comfort in doing literature and review of suicide and reading everything he could to try to make sense and understand how this could happen. So he needed to work that way first before he could come around to the emotional and to the sense of personal loss. And we have to respect that.
About it, and I was shocked to see so little out there about suicide grief, and even more so about grief associated with drug bereavement loss. There was nothing out there. Our study, based on 48 people, was the first systematic survey done with a drug bereaved experience.
That's amazing, especially given that it's increasing at a rapid rate.
So I want to thank you guys for being on it. I've got to show your book once more and say Devastating Losses, How Parents Cope with the Death of a Child to Suicide and Drugs. And I will tell you, this is an amazing book, and you definitely need to tell other people and let people know about this, because this just got so much wonderful information in it. And is there some way that people can get in touch with you too if they want to?
I would say our email address, feigelma@ncc.edu, or Feigelma, feigelma@aol.com. Either way will get to us.
Thank you too so much for being on the show today and for all the wonderful work that you do. And I know that you're interested in, our next guest, Vanessa McGannon, and she is with, how did you say her last name?
McCowan.
McCowan, I said it right.
McCann,
that was it, I knew. Okay, and she's does some work for the American Association of Suicidology, and I know you guys are interested in that, and we're going to play a little clip right now, and thank you so much, and we're looking forward to seeing you guys at the Association of Death Educators, ADAP.
Yes. Thank you for the important work you're doing and for helping so many.
Thank you.
Okay.
The reality of suicide is a very complex reality, and it's one that can't be usually covered in a sound bite or a very short explanation.
Suicide is a behavior. It's not a disease, it's not an illness, it's not something that you can catch from your friends.
Most of us don't think about suicide until it touches our life.
Well, my dad died by suicide in 1990. My reactions, in addition to the usual shock and profound grief, was to want to go to war, to get revenge about what killed my dad. And of course, with suicide, you can't physically attack it, so I've decided to attack it through science. I believe that that's the only way that we're ultimately going to get a handle on this massive international killer.
I'm working in the field of suicide prevention because I believe that we can help people choose life. I can't imagine anything more devastating along your life path than that. So I'm drawn to help because I believe we can.
I am primarily a clinician and have worked with patients who are suicidal basically almost all the time, and have been touched by both families who have lost their family members to suicide, as well as have worked with patients who've died by suicide.
AES is the one place that, in my experience, that allows the sharing of ideas.
This organization really is a family, and we have come together not only because of a common interest, but because we all share a passion, and that passion is to prevent suicide.
This is really the place where people come to for the knowledge that moves this field forward.
No matter what you do within the broad field of suicide, there's something for you.
Well, Vanessa, welcome to our show today.
Thank you. Thank you for having me.
Yeah, this
Hi,
American
Vanessa.
Association of Suicidology, you do some work with them, right?
Mm-hmm.
And I know one of the things that people are concerned about after they've had a suicide in their family or other suicides. You know, there may be other suicides in the family. And do you work with that kind of thing?
Yeah, I'm a clinical psychologist. I deal a lot with survivors of suicide, family members, and oftentimes they're worried if they lost their husband, if they lost their sibling, you know, what will happen to my children, what will happen to my other relatives. And unfortunately, there is a slightly higher statistic of family members dying by suicide, you know, after there's been a suicide. So it's always a fear, you know, I sort of deal with how much of a fear, or whether to get other people help if they need it, you know, and how much you have to live with the uncertainty that you know is a reality after you've lost somebody from suicide.
You know, I like one thing that when we talk about this, Heidi, that Vanessa normalizes this, that it would be a normal reaction if you've had to, you know, because, you know, sometimes we think when these things happen that they're not normal reactions to things. I know one of the things you're doing for the American Association of Suicidology is you're working with therapists who actually deal with suicide.
You were talking earlier about how stigmatizing loss to suicide is, and one of the groups that feels the most stigmatized is a clinician who's trying to help somebody, and then they lose their client or their patient to suicide. You know, family members have trouble talking to their friends, their colleagues, but clinicians have confidentiality issues and have fear of lawsuits. So it's a very difficult grief to move through.
That's so interesting because as a psychologist myself, it is our biggest fears that, you know, one of our clients will die by suicide. Especially when you have some clients that have suicidal ideations and kind of, you know, have clinical depression, etc.
Right. And we have so much responsibility. We feel so much it's our role to help them. And so if they die by suicide, you know, it's our fault. What do we do? Unfortunately, sometimes we have colleagues who are thinking those same things.
Well, and I'm thinking, you know, here we are as psychologists, and even we can do everything we can do for our clients and sometimes miss the signs. So I'm always saying to families, kind of don't be so hard on yourself, because, you know, when people are going through a hard time, they're often very good at hiding it or not disclosing. Because I know for families, they often put a lot of pressure on themselves. We should have known more. We should have reacted differently. Why did we miss those signs? And what do you say to families that kind of have those kind of guilt feelings?
Asking those questions are part of the grieving process for a suicide, and I'm open to listening and talking about those questions for as long as they need to ask them. But I think eventually it sort of shifts into thinking about the person's life, thinking about the good things they had, and not so much in terms of how they could have seen something or prevented something.
You know, I recently read a study that was done that, it was in New York, I don't remember the exact hospital, but they found that half of the people that attempted suicide and completed it had been in therapy. And the call that this therapist gave, you know, the the head of the study was, we do need some new methods of working with suicidal people. So one of the things that I think people have to realize is that having your family member in therapy is not a guarantee that they're not going to kill themselves or complete a suicide.
And that's one of the things that's great about the American Association of Suicidology. It's so many great thinkers from different fields coming together saying, how can we prevent a suicide? It's academicians, it's researchers, it's clinicians, it's crisis workers, and we all sort of get together as this think tank and really work on the prevention of suicide. I think, if I can say, I think that the training could be improved for all of the mental health workers in terms of how to assess, how to treat suicide. I think there's also, unfortunately, a reality that some people are going to take their lives, and as clinicians or family members, we may not be privy to that. You know, the people may not want us to be privy to that. I often say that I think that people have two tracks. Part of them wants to live, and part of them wants to die. And if we're sitting and assessing where they are, they may well be on that I want to live track, you know, and you're doing your best. You're finding out information. It's just that a day or two later, they may be in a different place.
Well, that's something to tell the families to think about. Those what you're talking about now for clinicians is so important for families to realize that, you know, there is this, you know, balance going on between the two. Yeah. Now, what, as a layperson, what would there be for me if I had a suicide with the American Association of Suicidology? Do you have conferences, walks? What kinds of things do you do that I could get involved in? Because I'm thinking that if I've had a suicide or a drug overdose or whatever, one of my family members has died, and I'm not even sure if it was suicide or not. I have a lot of that happen at Compassionate Friends. A lot of people come in and they're not sure whether their family member really did take their own life. Are there things that I can do to give back? I know the Feigelmans wrote a book and did research, and what could I do that would be smaller? Can I walk? Can I do something to help?
The American Association of Suicidology doesn't have walks. The American Foundation for Suicide Prevention does.
So I could do that.
You could go to that website. There's a conference that we hold every year, and part of it is sort of a larger, more academic conference, but there's a healing day, which this year is going to be April 12th in Los Angeles, if people are interested in going to that. And it's a full day programming. There's usually a main speaker that talks about their loss or the great things they've done through their loss, you know, in terms of making foundations or doing research. And then there's breakout groups where you could meet based on your relationship, if you've lost a sibling, if you've lost a client or a patient, if you've lost a parent. There are, you know, support groups. And then there's a couple of other things like art therapy. You might be able to see a film. So it's a full day programming for people who are grieving a suicide.
I love this idea because I feel like, as we've talked earlier on the show, people that have had someone die by suicide get so little support from just the outside. And to be in a place where other people, to a certain extent, can relate to what you're going through and can relate to the fact that you're not getting support and be there to support each other, I think is very powerful.
Yeah, I don't know if you know this, but I lost my sister 9 years ago to suicide.
No, I didn't know.
And being a new clinician and feeling very abandoned, I guess, by many friends and colleagues, I really didn't know where to turn, and I happened to find something about the American Association of Suicidology. It was in Colorado. I'm a New Yorker. I'd never been anywhere else but New York and you know, the West Coast. And I went out to Colorado, and it was really like a home. It was like, wow, here's a place where I can grieve and where people understand me, both as a professional and a family member, how to grieve a suicide.
Wow. Well, thank you so much for coming on the show today and sharing all this with us.
Yes, thank you for the work you're doing in tribute to your sister, and I'm so glad you shared that piece with us. As a brief sibling, I can identify with losing a sibling and how hard it is.
Yeah.
And
if I can just add, if clinicians are interested in a support group online, they can go to the American Association of Suicide website, and there's information there for clinician loss.
Well, thanks so much for being on the show today.
Thank you.
It's been wonderful
Thank you
having you on. And now we're going to hear Larry Stevens sing his original song, Deja Vu de Glow. Thanks for listening, and God bless.
A soul can't help but wonder why it can't remember what it already knows. The the sound of rolling thunder, the warmth of burning embers, a strange and yet familiar deja vu do glow. Prime whispers haunt me like a ghost from long ago, just a ripple in a river too deep to even show. Just a little deja vu do glow. Well, just a little deja vu do glow. Visions in the moonlight at the stroke of midnight, numbers and names on a stone, dancing in the memories, too sweet to ever bury, shadows shaped like bodies in a deja vu do. Prime whispers taunt me like a ghost from long ago, just a ripple in a river too deep to even show. Just a little deja vu do glow. Well, just a little deja vu do glow. Yeah, I know. Do-do-do-do. Do-do-do-do-do-do. Prime whispers taunt me like a ghost from long ago, just a ripple in a river too deep to even show. Prime whispers haunt me like a ghost from long ago, just a ripple in a river too deep to even show. Just a little deja vu do glow. Well, just a little deja vu do glow.